Hello everyone and welcome to my channel. We have started the preparation for pediatric subject and we have studied the topics from neonatology. Today we will discuss the large for gestational age. So we are having the scenario that there is a male baby born at 32 weeks of gestation to a diabetic mother. His birth weight is 4.8 kg and he has a round and plethoric face. How will you classify this baby according to his gestational age and weight, and what are the complications and how to prevent the treatment? Another scenario is that there is a 30 years old multigravida gave birth to 4.5 kg at 32 weeks of gestation by C-section. Mother has gestational diabetes and poorly controlled blood sugar. So here we are having some diagnostic points that certain cases are discussed in which large for gestational age baby may born, that is diabetic mother and multigravida mother, and also the weight is greater than 3.5 kg. 3.5 kg weight is normal for birth. Here the weight given is 4.8 kg. So this is the large for gestational age baby. Now the definition is that newborn is called large for gestational age if the birth weight is 2 standard deviation above mean or above 90th percentile. Okay, the mean is 3.5. If it is above the 2 standard deviation, then it is large for gestational age. Now the causes are constitutionally large infants are of large parents, infants of the diabetic mother, Beckwith-Wiedemann syndrome, and some post-term infants, infants with transposition of the great arteries and erythroblastosis vitellosis. These are the causes of the large for gestational age. Constitutionally large infants are of large parents, infants of diabetic mother, Beckwith-Wiedemann syndrome, post-term infants, infants with transposition of great arteries and erythroblastosis vitellosis. Now the complications of large for gestational age are birth asphyxia, birth trauma, hypoglycemia, polycythemia. The classification of large for gestational time gestational age is preterm large for gestational age, late preterm large for gestational age, post-term large for gestational age, extremely low birth weight, and low birth weight gestational age. The management options for large of gestational age is that infants should be evaluated for above complications and managed appropriately. That is the birth asphyxia, birth trauma, hypoglycemia, and polycythemia. Hypoglycemia should be monitored, and infants should be fed early because some large for gestational age infants have hyperinsulinemia, that is diabetes mellitus and erythroblastosis vitellosis, Beckwith-Wiedemann syndrome, and so are prone to hypoglycemia. So the care should be taken of these conditions that the following complications can occur in the large for gestational age baby. So one should be careful while treating it. Now coming towards the small for gestational age baby, we are having a scenario that there is a baby born at 35 weeks of gestation by NVD. He cried immediately at birth. His birth weight is 1.8 kg, that is 35 weeks, and 2 kg is normal. So define the baby, what complications can baby develop, and outline the treatment. The definition of small for gestational age is that the baby whose birth weight is less than 10th centile for his gestation or more than 2 standard deviation below the mean for gestation. Now the causes of small for gestational age are maternal causes, fetal causes, and placental causes. In maternal causes, we are having hypertension, pregnancy-induced hypertension, chronic renal diseases, diabetes mellitus, and heart disease. In young age less than 18 years, poor maternal weight gain in pregnancy, fundal leg less than 4 cm, short stature, anemia, and pre-pregnancy weight less than 50 kg, history of intrauterine growth retardation, multiple pregnancy, and poor socioeconomic status, malnutrition, smoking in mother, and drugs. These are the maternal causes of the small for gestational age. The fetal causes are chromosomal disorders, that is trisomy 13, 18, 21, and Turner syndrome, congenital infections, that is Torch infection, congenital malformations, renal dysgenesis, agenesis, Porter syndrome, congestive heart disease. The placental causes are decreased placental weight or okay, decrease in surface area, and virus placentas, that is viral, bacterial, parasitic, and infarction, and placental separation, and tumor, and twin transfusion syndrome. These are the placental causes of the small for gestational age. Now, what are the problems of small of gestational age? These are hypoglycemia, hypothermia, polycythemia, hypocalcemia, infectious congenital abnormalities, perinatal asphyxia, meconium aspiration, pulmonary hemorrhage, and neurotizing enterocolitis. The management options of the small for gestational age are early obstetric diagnosis and planned delivery in the presence of pediatrician is very important to do good resuscitation and for prevention of meconium aspiration and asphyxia. Then infants should be carefully monitored for potential complications, especially hypoglycemia and polycythemia. So glucose level should be checked frequently. Then early feeding should be instituted. Start feeding milk at 1 hour of age and then continue feeding every 3 hours. And if feeding are not tolerated, feed by NG tube is given or total parental route. And small for gestational infants require more calorie per kg for growth than appropriate for gestational age. Baby should be nursed in thermoneutral environment and evaluate and manage for congenital infections and congenital malformations. Chromosomal and genetic evaluation in suspected cases is indicated. A prognosis is good nutrition, good parental care, then the outcome is good. Okay, so we have discussed the small for gestational age. We have discussed the scenario, then the definition, then the different causes, which are maternal, fetal, and placental causes. Then what are the complications of small for gestational age, and how should we manage the patient of small for gestational age. Now coming towards the premature and appropriate for gestational age. So we are having a scenario that there is a you are called to attend an emergency delivery of lady who is in labor since morning. She gave birth to a baby whose gestational age is 34 weeks and weight is 2 gram. How will you classify baby according to gestational age, and what acute problems can baby have with explanation, and how you will manage the baby? Okay, so if the weight is less than 2 kgs, then it is small for gestational age, and at 2 kg it is appropriate for gestational age. So we are having a definition that okay, this baby is born at 34 weeks, so this is preterm baby. It is defined as live born infant delivery before 37 weeks from first day of last menstrual period. This is the definition of preterm baby, that if a baby is born before 37 weeks, then it is termed as preterm baby. The causes are maternal causes, uterine causes, fetal causes, and others. The maternal causes are malnutrition and anemia, teenage pregnancy and parity, twin pregnancy, preeclampsia, diabetes mellitus, renal disease, heart defects, hypertension, malaria, UTI, chorioamniocentesis, low socioeconomic status, smoking, and these are the maternal causes. The uterine causes are bicornuate uterus, incompetent cervix, and placenta previa, abruptio placenta, and placental dysfunction. The fetal causes are fetal distress, multiple gestation, chromosomal disorders like Down syndrome, intrauterine infections, for example, syphilis and toxoplasmosis, erythroblastosis, non-immune hydrops. The other causes are polyhydramnios, trauma, premature rupture of the membrane, and iatrogenic causes. The problems of prematurity are immediate causes and long-term. These are hypothermia, hypoglycemia, hypocalcemia, respiratory difficulties, intraventricular hemorrhage, liver immaturity, increased susceptibility to infections, necrotizing enterocolitis, patent ductus arteriosus, feeding problems, anemia of prematurity, retinopathy, and metabolic bone disease of the prematurity. The long-term defects are chronic lung diseases, poor growth, and CNS dysfunction. The management options for appropriate for gestational age and preterm baby is delivery room care, that is attended by pediatrician, proper resuscitation at birth, stabilize vitals, prevent hypothermia, hypoglycemia in delivery room. Then baby normal size baby shift to the nursery, and baby weight 1 to 1.5 kg is shifted to the ICU. After birth care is provided, that is maintain thermoneutral environment, maintenance of the fluid and electrolyte balance, oxygen administration, feeding, supplementation of the iron and vitamins, protection from infection, early detection and management of the complication of prematurity and immaturity of the drug metabolism. So we have discussed the following three topics, that is large for gestational age, in which we discuss the scenario, then the definition, then the different causes, then what are the complications, and how we will manage the patient for large for gestational age. Then we have discussed the small for gestational age, the definition, the causes which are maternal, fetal, and placental. Then we have discussed the complications of small for gestational age, and we have discussed the management options and the prognosis. Then we are having the scenario of the appropriate for gestational age of the baby who is preterm. Then we have discussed the definition of the preterm baby. Then we discussed the causes which are maternal, uterine, fetal, and other causes. Then we have discussed the complications or the problems of prematurity, which are both acute and long term. Then we discuss the management options, which are delivery room care and after birth care. In the next video, we will discuss the hypoglycemia, and also a small topic is remaining, that is post-term infant. This we will discuss in the next video. Then we will complete the neonatology, and in the next section we will discuss the acute diarrhea, which is the most favorite topic of the pediatric department in the professional exams. Thanks for watching.